Hey guys, it's Alex. So I went to my Howard Brown appointment, number one, to get screened, for HRT, and, so I'm just gonna talk about my experiences there, and then also my Dr. Steinwald follow-up. Um, Now, whenever I went to Howard Brown, I had made a call in advance and told them that I had insurance. Well, I've recently had a legal name change, and whenever I went to go and give them my insurance card for it to be processed, they weren't allowed to process it under my current legal name because my birth name was still on the insurance information. So it wouldn't have gone through because they think it's two different people, even though it's not. Um, so I have to talk to my dad about that, but he is being kind of like a two-faced ally. Not really like supportive like to me, but like when around other people, not really supportive. Um, and I'm gonna have to get my ID and my everything changed again anyway because of my gender marker, which will be in the mail. My gender marker change form in the mail this week, I think, from Dr. Steinwald. So after I dealt with all of that, I was called back into the, like, I guess, doctor's room, for my doctor to come visit me. Now, my doctor's a pediatrician, so he handles, prescribing, HRT, like testosterone, in my case, to anybody that is under 24 years old, which would be me because I'm 22. Now, whenever I got in there, they had to take my weight and my height and all that junk down. And then, whenever the doctor came in, they were, he asked me a whole bunch of questions. Some of them were really, really sensitive, and, he didn't use a lot of trigger words, but he did warn you that they could trigger any, like, anxiety or dysphoria. And he was really careful about that because, it's like the worst thing for like somebody to trigger dysphoria. So just to remind you, they need to know everything about your medical history, even currently. So they're gonna ask sensitive questions about your like mental state and also physical state. And they're also going to ask you about if you want to have children in the future and how you want to go about that. Now, I have a big issue with it because I do not want to have children that are biologically mine, because if I am on testosterone, I have to get off of it and be souped up with estrogen, which is totally the opposite of what I want. So they can harvest, and then make babies, which is not what I want at all. So the first appointment, you can have anybody come with you. So if you have a parent or a friend that is supportive, or your partner even, they can come in with you, and they can address that question if you don't feel comfortable talking about it. And then after that, they ordered labs, and I did have to take a urine sample, and they took 4 vials of blood to test my levels, to make sure that I am able to be on T. Now, all of their staff is very diverse. Their bathrooms they all say gender neutral for non-binary and for people of all genders. And they have multiple ones throughout the facility. I went to the one on Halstead, which it's Howard Brown, but it's called Eris Health. And I have a next appointment for my second and third appointment are both on the same day, on the 22nd. So I'll be making another video about those, and if I am prescribed T, because I have to talk to basically a doctor that says that it's like, you're in a sound mind to make this decision, and nobody's influencing you or pressuring you to make this decision, to start HRT treatment. So I do like to point out that it is not FDA certified for transition. The medicine itself is FDA certified, but for using it for transition, it is not, in case that worries anybody. So the next day, I went to my last appointment with Dr. Steinwald, for top surgery. And we got there, and I had to inform them that I had a legal name change, so they changed all of that in my record, which was pretty cool. And then we had the appointment, and he basically just, like, you know, looked at my chest, took after photos, and he's going to post them online on his site, but you're not going to know it's me, obviously, unless you got any of my tattoos in the photos. And he talked to me about possibly going back for revisions, because I did have a larger chest, I guess, whenever I went in, and I am kind of chunky, but I got gym membership, so I'm working on that. So I have, like, this kind of, like, ballooning thing on the sides. So he wants to go back in for revisions, but I'm not sure if I want to do that because he's moving to Colorado. But he said all was fine and I could start Mederma or vitamin E. And I tried Mederma on one side and vitamin E on the other. And when I noticed that whenever I put the vitamin E on, it felt nice and it was moisturizing. But whenever I used the Mederma, it kind of it made redness around the entire area that I applied it on, and it was kind of stiff and gross, and it kind of itched a lot. So I think I might be allergic to something in it. So I'm strictly using vitamin E oil now, which kind of sucks because Mederma is known for scars. But I guess I'll have to do it, like, I guess the natural way, instead of putting whatever the heck is in this crap on me to make me red and itchy. So, yeah, and I don't have to go back to see Dr. Steinwald. I got my new Social Security card in the mail. Now, I will have to go back to the driver's license bureau to get my gender marker changed, because Dr. Steinwald and his office manager said that should be in the mail this next week. So I will be able to get my gender marker changed and everything with that. So I'll make another video telling the process of how to get your Social Security card changed, your birth certificate, your driver's license, that kind of stuff. If you're a university student, I am planning on making a manual on how to do that through university, like specific to my university, but I will talk about that and put it online as well. So yeah, it's great talking to you guys. I hope you watch this video, like and share it, whatever, and check out our Tumblr, Trans and Transplant. Yeah, happy holidays.